The pharmacokinetic properties of a medication, that is, the body's effects on the drug, can be an important factor in determining how successful a treatment is. Pharmacokinetics are particularly important when converting from oral antipsychotics to long-acting injectable antipsychotics, or LAIs. To initiate LAIs correctly, one must understand their kinetic parameters and the relationship of plasma concentrations to clinical effects. As soon as a medication enters the blood, the body begins the process of eliminating it. The half-life of a medication is how long it takes for the body to remove 50% of the maximum plasma concentration of the drug. With repeated dosing at regular intervals, the intake and the elimination of the drug will achieve equilibrium. This is known as steady state. In general, 5 half-lives of any medication are needed to achieve steady state levels. Typically, when an immediate-release medication is administered orally, it is absorbed rapidly. How long it takes to remove the medication from the body is therefore largely dependent on the rate of elimination. This also means that the time to steady state with repeated dosing is a function of elimination rate. With LAIs, the rate of absorption is much slower than the rate of elimination, which leads to something called Flipflop Kinetics. That is, because the medication cannot be eliminated until it is absorbed, the terminal slope is largely dependent on the absorption rate. In this case, the time to steady state is a function of absorption rate. For example, the observed terminal phase decline in plasma levels of fluphenazine decanoate corresponds to a half-life of 8 to 14 days, rather than the elimination half-life of 15 to 24 hours. Likewise, for haloperidol decanoate, the observed terminal half-life is 19 to 21 days rather than 15 to 24 hours. Thus, the time to steady state can be weeks or even months. The long half-lives of LAIs mean that, when converting from oral, one must either adequately load the dose, if possible, or provide oral supplementation. A loading dose is the dose required to immediately achieve a plasma concentration that is equivalent to the steady-state concentration. The failure to adequately load the dose can lead to subtherapeutic antipsychotic plasma levels for weeks or months in patients who are not receiving or adhering to oral supplementation.